It is currently 3 a.m., but it's surgery day. I need to get up, walk my dog, and get prepped because check-in time is 5:30, so let's go. I am prepped. I'm ready to go. I've taken my shower. Literally dial soap, no lotion, no deodorant, no oils, no perfumes. And I feel dry as I could ever be. I have my teeth whitening strips in. So if I'm like slurring or slipping over my words or whatever else, I got a lisp, that's why. Here is the fit. I zip up as I was told to, and I put on black sweatpants because, yeah, I am going into surgery. And even though when I come home, it'll be 24 hours post-op, it's gonna be a lot going on. But here we are. I'm gonna be switching to my phone just because they told me to only bring my phone, my ID, and really nothing else. So there will be most footage on there at the hospital, but let's go because it's time to leave. We made it out. Tired, sore. I feel like I've done 100+ push-ups, but we're out and we've made it. The surgery was scheduled at 7:30. It was a total time of 5.5 hours. I spent a few hours in the recovery area before getting moved upstairs in a private room. When I did get moved upstairs, one of my friends was here. I instantly started crying. Like instantly, it was a little baby started crying, which hurts my stomach. But my friend was here. She stayed for a while before she went to work. And then my mom and my son stopped by to check in on me. Iho starts crying when he leaves because he has to leave me here. He was worried about me, which I start crying again. Like, I'm okay, Papa. And he wasn't understanding why we had to leave. But outside of, like I said, my stomach just feeling like I've done 100+ push-ups, sit-ups, I'm doing okay. I'm on a clear liquid diet. I'll be here at least until the morning, or at least tomorrow. We'll see how long they keep me. But yeah, that's that on that. It is the following morning, so it is Friday, May 30th. I have gotten to go to the bathroom on my own. Well, walked. I was able to walk to the bathroom. I did 2 laps around the nurse's station. I was able to get switched from clear diet to solid food diet. What else? I'm really just sore. Again, if I didn't mention already, it's like I did 100 sit-ups. So I'm just sore, like tight and sore. I've been switching between Tylenol and a low-grade oxycodone for pain relief. But yeah, that's really it. I'm feeling okay outside of that. I meet with the surgeon. I believe he said at 9 or 9:30 he would stop by to like talk and check with me. But I am supposed to meet him in a couple hours, get the all clear if I'm able to leave or not, and then go from there. I'm not draining too much. Clearly still have my drains. The nurses come and check on them every like 4 to 6 hours. But I'm not draining like a lot. It is drainage, but not too much. yeah, everything I feel like outside of that is going pretty well. And I hope I get to go home today. Just because, like, I want to be in my own bed. Still will not be able to lay flat, but really just would like to be in my own bed. We're prepping to go home. I've made it home. I've switched back to my actual camera instead of my phone. I'm somewhat hunched over because, let me prop this up. I am not supposed to stand straight up, so I am hunched over. Doctor's orders, but outside of some slight, just like soreness, it's not pain, it's just sore. I keep using the illustration or the analogy of, I feel like I've done 100 sit-ups. That's what it feels like. You just worked the hell out of your ab muscles, and that's what it feels like. Other than that, I am pretty okay. I'm just gonna be recovering it, taking it easy. I'm gonna lay down. I need to prop myself up because I cannot lay flat for the first couple of weeks. So I'm about to adjust these pillows and lay down, but just checking in once again. I got to see my stomach today. I don't know if I mentioned that in one of the other videos on my phone, but I got to see my stomach today because they changed my bandages, and wow, 7 pounds of skin removal makes a difference. So yeah, I can't wait to be able to actually show fully and even see myself fully what I look like standing straight up. But yeah, we're going to go ahead and get situated and lay down because there's nothing else for me to do right now, and I should not be doing nothing else because everyone is going to fuss at me if I do anything more. So I'll check back in a little bit. It is Wednesday, June 4th. I am in the middle of stripping my drains and dumping them for my morning, like my morning log. But I am 6 days post-op, and I'm going to see my surgeon today in hopes that at least one drain and these ACE bandages will come off. Like, it has been an experience with these things. So I will attempt to check back in once I get to my surgeon's office this morning. So that way, I don't know, we can see because fingers crossed. See you guys in a little bit. Hi.
Look at you moving all fine.
Thanks. Better than day one.
No worries. I'm gonna come around. I'll meet you over here.
Okay. Okay. Thank you.
You're welcome. We're gonna go all the way around again today.
Okay.
So right at this hallway and right at the next. And that open door to your left.
This one?
Yes,
Okay.
ma'am.
Thank you much.
You
Okay.
are so welcome. We will just have you remove your jacket and your pants.
Okay.
And then they'll be ready for you, okay?
Okay, thank you
Do
so
need
much.
water or anything?
No, ma'am, but my mom is coming in. Oh,
Okay.
she's gonna be a little black person, so yes.
I'll bring her in.
Thank you so much.
You're welcome.
I am home and out of my ACE bandages. I did attempt to start filming prior to, well, when I was at the surgeon's office, but I did let him know that I don't want to make anybody else feel uncomfortable or anybody else that does not want to be on camera to be on camera. And so I just ended the recording because they were helping me. So both my surgeon and his assistant, his medical assistant, would have been on camera. And again, I'm doing it for my angle, not necessarily for anybody else to be in there. So that's just that. That's why we didn't really get too much footage in the actual room, but it was really them checking my scars and my stitching on each arm and along my stomach and along my belly button. I got all my external stitches removed on my belly button, and I still have internal ones. And again, they swapped me out of the ACE bandages to put me in compression sleeves, and honestly, these feel so much better compared to the ACE bandages, simply because of the fact that the ACE bandages were sticky. Not sticky, scratchy. They were very scratchy and uncomfortable, and if you wrap them too tight, like if I was cutting off circulation in the lower half of my arms, like it was just so much back and forth with it. This,
I do have this part in the front, which is not like maybe the most favorite part, but I will take this over the bandages any day. And like I said, I also have like, it hooks in the back like a bra, which I don't know how I'm gonna be able to do that by myself after my mom leaves, but we'll tackle that hill when we get there. But nonetheless, I have both of my drains in still. He says that maybe next week I'll get one of them out when I see him. It's just right now I'm still draining quite a decent amount, but nonetheless, I'm happy, I'm content. I weighed myself while I was there. I'm 168. Prior to surgery, like the couple days before, I think I was like 178, 177, something like that. So 10 pounds almost, well, practically a week post-surgery. Well, I'll be 1 week post-surgery tomorrow. We'll say a week since the last time I weighed in, which I thought I was gonna be slightly heavier than what the last time I got on the scale, just because I do have lots of fluid left in my body, and I will still have fluid even after the drains get out, and probably a month or two, maybe even 3 months after the surgery, even longer. So I just assumed I would still be a little bit heavier for the time being, but seeing that was kind of like, oh, okay, like we're still going downhill, and I still have to, again, relinquish all the fluids that are still in my body. So it's just shocking for a girl who used to always be a plus size girl. Like, to be this small, I have never been this small. It's kind of weird, truthfully. But that's the update for today. I will give it some more time. We'll see, but I'm feeling better. I'm moving better. I'm not on really any of the medication he gave me, which was like a stool softener, Zofran, which is like the nausea medication. I have a muscle relaxant, and then I also had like the actual opioid for pain relief, which I stopped taking that like a day or two after. It wasn't that bad for me, but I'm happy about that. I'm happy I'm able to move around more. Still very much don't lift anything really over 10 pounds, which found out a gallon of milk is like about 8. So not lifting anything above 10 pounds, no driving, still sleeping with like an elevated position, my half body up and my legs lifted. But again, nonetheless, I'm feeling great and I'm happy and I'm content. And yeah, that's this part of it. Let's see what the next couple of weeks bring. Good morning. It is the 10th and it's about 7:30, 7:15. I got my mom dropped off at the airport and I am back. Let's see how I can set this up so you guys can see me properly. I am currently in this state. I have my drains up here just because they've been a little bit easier to manage than having them just still hanging down. I've been pretty much wearing shorts and a baggy t-shirt. One, because Arizona has officially hit summertime, so it's 100 degrees plus in the daytime and still 90 plus at night with the sun down. So shorts and a baggy tee the past couple of days. Again, one, to help with the heat, and two, to help hide some of my drains because you can see them still even though they are in my chest area. But I'm feeling great. I go see my surgeon on Friday and I am not draining too bad out of my left one. Like, I'm barely clocking 20 cc's every 2 hours, every 12 hours. And I know I read somewhere that they typically won't remove a drain or drains if you are 60 cc's or higher. So that's why I feel like I didn't get any out last week, because I was still draining about, what was this, 120 cc's a day, about 60 cc's per side. So I have one on my left side and one on my right side. So I'm hoping that the left one gets taken out this week, as like I said, it's barely touching 20 cc's every 12 hours, so about 40 cc's a day, if not less. The other one's still very much draining at 60 cc's, but that's okay. Everything's a journey. I don't expect to get them both out at the same time, but that's that. Also, disregard my hair. I'm gonna touch it up later. It's just obviously been a couple other things more important than that. However, I don't think I have any other updates. I'm gonna get my dog out real quick before it even gets hotter. She has shoes, but I also don't want to be outside too long, and I'm technically not supposed to be walking her, but what can I do? My resources are limited. So let's do that, and I probably will check back in with you guys on Friday. Morning, friends. Happy Friday, the 13th at that. I am in my typical location when I've been filming these, which is in my bathroom, so it is what it is. You enjoy it or you don't. I need to prop this up somewhere. Good morning. Like I said, it's Friday the 13th. I am prepping to get ready for my appointment with my surgeon today. So yesterday I officially made 2 weeks post-op. I feel a lot better. However, my surgeon likes to tell me that mentally you'll feel better than what your body physically can handle, which I don't doubt that's the case. But as you know from last week, I'm not going to be able to take you in with me, so I'm just giving a little pre-appointment, what do I want to use? Pre-appointment thoughts right now. So I am looking forward to getting one of my drains removed. So I really do believe my left side will come out today because I've been tracking my drainage on a chart, and that one is barely draining. Like every 24 hours, I might get like 10 cc's. My right one's still very much 30 cc's or higher. Like every 12 hours. So at least if I can get the left one out, I'm hoping that's the case, fingers crossed, because they are really the most uncomfortable part of my journey. I'm not really in too much pain. It's just like sometimes they bring discomfort. Sometimes the cord or the drainage tube itself will get hooked onto like my drawer handle, and I don't realize it. Sometimes it's in my bathroom. I have these, so these things, so sometimes my drainage tube will get caught on this and on these ones when I like get out the shower, or if I'm not wearing like something to cover them. And that's really the most uncomfortable part because I don't realize it until after I like lean backwards or scoot backwards and I feel the tug. And where the drainage tubes are placed wasn't somewhere I thought they were gonna be. Let's just say that. If you had a tummy tuck, then you know where I might be talking about. I assume they're all being put in the same spot, but they're literally right above, like, they're literally attached above in the same vicinity as the private part. And I'm just like, you could have told me that pre-surgery. So that's annoying. And I will be touching bases with him because I've been having issues with my tapes that are on my stitches on my arms and across the tummy tuck area because it's heating up outside. And although they're water resistant, like they said, it doesn't mean that when I sweat and they're in these compression garments and stuff that the glue isn't gonna heat up and become like not tacky. So sometimes when I'm taking off my compression sleeves and my wraps across my stomach, my binder and stuff, specifically when I have the pads on with the binder, they always stick and it's always really annoying. So hopefully I can talk to them about that. A side note, outside of pre-surgeon appointment thoughts, I uploaded my intro video today. And although you won't see this video for maybe a couple weeks because I don't know how I'm going to load them together yet or how I want to do this, but nonetheless, I got my intro video uploaded today, Friday the 13th, and I am content. That's all. I just wanted to say that because I have been doing YouTube on and off for some time. I'm never as consistent as I would like to be, and this time I'm just going with the flow. I don't want to set any standards as to, oh, I'm going to post every week or every 2 weeks. We're just going to go with the flow. And when you get the video, you get the video. And I hope you enjoy it. Like I said, it's going to be for some and not for others. But there are also plenty other vloggers and YouTubers that film that are on a weekly basis or a bi-weekly basis or whatever. And, you know, you can supplement those. It's like a TV show, a TV series, you know. Sometimes I have to watch Bob's Burger when Rick and Morty isn't playing, or I watch CSI when SVU is off, even though CSI has been off for years. But nonetheless, you know, you mix and you mingle and you get in where you fit in. So that's that. I'm going to get ready because, as you can see, I'm still in my jammies. And we're going to go and come back. And after that, we'll say what he says. And hopefully, like I said, we get at least one of my drains removed today. Oh, hello. Real close in person with this shot. Hi, friends. I'm back from my appointment with my surgeon. And we did get a drain out. I got my left one removed. It really wasn't bad. I really had nothing to say. I think I had seen some like blog posts saying that they felt more so a sensation when it coming out. I kind of felt the sensation, kind of didn't, but we got it removed. I would think I was more so nervous than it actually was, but got my drain removed. The other one is going to stay in. He says probably until the next visit, but my next one is on a Wednesday and today's Friday. So it's only 5 days from today. So I'm not going to get too amped up to think like, oh, I'll get it out on Wednesday. I'm gonna assume in 2 visits, I'll be able to get it taken out because it's still draining quite a bit. And he even said now that the first one is gone, this one might pick up a little bit before it lessens. And I can already tell that's happening due to the fact that the other one at max was draining like 10 cc's every 12 hours. But I noticed my right one was draining like sometimes 40. I think I might have hit 50 at one point as well. So I can already tell that's happening, but nonetheless, 1 drain less than I was before. And that makes me happy. They took my weight. I'm sitting at 173, but I can tell I have a decent amount of fluids and I won't be able to get any lymphatic massages until my 6-week mark. That's what my surgeon set for me. I don't know if that's the standard. I don't know if other people have different things. He just specifically said he wants to wait till I'm at least 6 weeks out because he doesn't want to put any stress on the stitching, which for me, that makes sense. So teetering back to my weight, I'm sitting at 173. My lowest was 170. I lied. I weighed at 168 last week. But even then, I thought that that was a little different because I assumed I would be a little bit heavier post-surgery with the fact that, again, fluids are still very much within my body. My hands swelled up last week on Saturday. I could tell they were swollen. Like my hand and my arm was swollen. So I'm not really banking or solidifying that weight. It's just what they needed to take, and that was what it said today. I, however, am feeling so good. I'm so happy. He gave me the clearance to not wear as many, what's it called? They're called abdominal pads, but basically I don't have to wear as much padding as before. They also removed all that glue that was covering the stitches on my arms and on my stomach. So the only alternative now is that I need to go get Aquaphor to help upkeep with that, which I just thought about that. That's something else I need to stop and get on the way home. But yeah, that's pretty much the gist of today's appointment. I also got the footage or the photo from my removal, so I don't know if I can or should post them on YouTube. They are graphic images. There's literally like skin and fat and tissue sitting on top of a scale. And I don't really know the guidelines of what YouTube will do if I do that. But I did get that footage. I might still post it somewhere. I don't know, because like I said, it's considered graphic content to some people. To me, I really don't care. I told him we could put it on a billboard. It wouldn't bother me because I think it's cool. Like, what do you mean? Like, let me see if I can show you. My incision, technically, this is where they cut it off and they pulled all this down to like connect with the lower half of my body. My belly button stays in the same place. They kind of rework the skin around it. But again, seeing that amount of skin sit on top of a table. I was like, dang, that was attached to me? You mean to tell me all that was here and it's not? It's like mind-blowing, absolutely mind-blowing. And yes, so I'm excited about that. Like I said, I think it's so cool. I'm glad I was able to get the photos. I was nervous that like he wouldn't want to share them, just because some people maybe don't want to share their work and they don't want it to get taken by other people, because people are weird. People are weird and they do that. But he was fine with it. He's like, more so as long as the client or the patient is okay with it, they are abiding by the HIPAA rules and stuff. Like I said, I told him he could put it on a billboard if he wanted to, because he mentioned that they could. It just more so depends on the patient per se. But I was like, you can send it to me in an email. I know it's not safe. I don't send it to me. You can put it on the billboard. You can plaster it all over social media. I worked hard to lose that 200 pounds and to remove that 7 pounds of skin. I'm proud. I don't have nothing to hide. Like, but that's the roundup about today's appointment, what's going on. There's nothing more to really discuss right now. Again, I'll meet with him on Wednesday to see if anything happens more, but I'm not banking on a drain coming out. I'm just seeing him because that's his rule. And yeah, I'm gonna go take my dog out for a walk. It is midday, but I'm technically not supposed to be walking her at all. I'm not supposed to be doing too much of anything really. He told me I'm supposed to be moving like a grandma. And I'm just like, sweetie, I got too many responsibilities to move like a grandma, honestly. I don't have as much support as I would like now that my mom is gone to do the things that you said you would like to. So I'm gonna take her out just really like around the block. It's hot enough to where we could spend a few minutes outside and it'll wear her out, because just like anybody else, if you stand outside long enough and not even doing anything, you'll come inside and all of a sudden you're exhausted because the heat has the sun has rather beat it down on you and it drains your energy. So again, I'm gonna take her out real quick. One, so that way it tires her out, and two, she doesn't get destructive. But that's me going on a tangent. I'm gonna go and I'll see you guys maybe Wednesday. Okay, hi friends. Today is currently August 7th. So today marks exactly 9 weeks post-surgery. And I know I've taken a couple weeks off of filming me going into my surgeon's office. Again, I couldn't film anything while in there. And truthfully, up until last week, which was, let me see, the 31st of July, I didn't get my drain out. My second drain did not come out until last week, July 31st. So again, it was a lot of me going to my surgeon, seeing him, making sure my incisions looked good and that they weren't causing any issues, as well as making sure obviously the drain was doing what it was supposed to, which it took so much longer. Again, it took a full 8 weeks before it came out, and all that. So I've been kind of just low-key. I was told to still just relax, take it slow, don't do much. So I've been kind of just sitting in my house and waiting patiently but impatiently to get that drain out. This past week felt good to finally be without it. It was a different feeling because I'm so used to having to hold it in the shower and when I'm getting dressed. So doing those things without it definitely was a like, finally. However, on that same note, I am very much still healing. I have some soreness still in my stomach. In certain occasions when I like clench really hard, like coughing or something, I can feel it from time to time. There is still very much numbing along my incisions, so a lot of massaging along them. I think I can just now get to the point of getting lymphatic massages. I could not do that up until I got the drain out and clearance from my surgeon. So these past few weeks have just been rather quote-unquote boring because there was nothing to show and really nothing for me to do. Like I said, I've just been relaxing in the house. But now that I have completed my 8 weeks and I can slowly start getting back into being me and doing my things, I look forward to this next, I don't want to say chapter, but this next part of my life, because these, having to sit down that long and just be with your thoughts definitely had me contemplating a lot of stuff. And I don't really know what is meant for me to happen in the future. Obviously, whatever's meant to be is whatever's meant to be. But again, being in your thoughts and by yourself really has you contemplating like a lot within life, at least for myself. But I needed to get this filmed because I feel like this specific vlog was just hanging there on a cliff because of the fact that I couldn't finish it, I felt, until I got my drain out. So the drain is out. We are done. We are feeling better. Scars are definitely in the works. Like I said, this is still numb. I have a hard time like recognizing sometimes the pressure in it, as well as along my stomach. So I'm done rambling on this vlog. We made it through the surgery. We made it through the 8 weeks in the drains. We made it to the let's get back to our lifestyle part. And now it's time to rock out because it ain't over yet. See you guys in the next one. Bye.